So, you've heard the saying, if you're a hammer, then everything looks like a nail, right? So my goal, and especially something I want us to shoot for, whether you're an anesthesia provider, a surgeon, a perioperative nurse, whatever, essentially it's kind of going along the themes of opening the siloed windows, right? Because I don't want us to be hammers, thinking, and general anesthetic for you, general anesthetic for you, general anesthetic for you, right? We can't do it that way. We need to be more than that. We need to be like this super sweet Swiss Army knife. That's the next level Army knife, right? So, and what I'm saying by this, and the idea from this is to recognize, especially as I'm looking mostly from us, but I think it applies across the whole thing, the whole scope of people that are taking care of patients. It's like, I need to know my job, but I need to make sure that I'm doing the best part of my job that I can do for that patient. So, yeah, I'm going to keep them anesthetized and comfortable. But it's like, well, I need to make sure I'm doing the best regarding their fluid management. I need to make sure to do the best that, hey, you know what? You want a tap block? I can do that for you. You want QL block? I can do that for you. You want an epidural that works? Oh, fine. Fine, yes, I can do that for you, right? So, all of these things, we need to make sure that we do the best that we can do within our scope, and then also have an idea and understanding of what happens afterwards and what needs to be happened for the patient thereafter. So again, be more than a hammer. So key anesthetic features for ERAS, and we've heard a little bit about it when you see them on the slides, and I'm not going to go into them in too much detail because luckily for all of us, there are other people that are going to share these things with you throughout the day, the next couple days. A big hot topic though, intravascular volume, PONV prophylaxis. I have new appreciation for this as well, as there I was in the recovery room. So I had my surgery add-on at the end of the day in the PACU, barfing my guts out. I'm like, come on, bro. My office mate and good friend did my anesthetic. I'm like, come on, dude. Why do you hate me? Anyway, so what did I do wrong? Anyway, so I have new appreciation for this because being nauseated in the PACU was less than desirable, as it turns out. And then pain management. And again, I have to give him props because the block that he did on my arm worked like a champ. I was super numb, didn't need narcotic, but man, I was green. So, intravascular volume. We'll briefly talk about this, later this morning. What is restrictive? What is liberal? What is goal-directed therapy versus what?